So yes, as I was saying, after I was rudely disturbed by the phone call from Oge, just telling me that they're on their way back, so I better make this quick. So I was about to go and visit this gentleman. The note stated that he was possibly end of life. Daughter was worried about his bowel motions, his urine problems, and he's deteriorating. He's got dementia, and they were worried that he's near the end of his days. So there's me thinking, okay, he needs a face-to-face home visit assessment to check and see how bad he is. Is he deteriorating? Can we do anything to intervene? So this whole, please phone me before you get there to tell me exactly when you're going. Can't always happen, and for me I find it difficult because one patient might take longer than I expect. So if I give them a time period, it may not be accurate. So I usually say it's going to be between 1 o'clock and 3 o'clock. Just be around. I know it's going to be difficult. Cancel your day and be around. So anyway, I did the first 3 visits. This one was quite close to the practice. On my way to the last visit, I was tempted to cancel that one because my time was short. I only had half an hour or so left, 45 minutes left. By the time I got to the house, did the visit, come out, I'm talking about another 25, 30 minutes. By the time I get back to write up the notes and do all the additional bits and bobs that may be needed, my afternoon clinic is going to start at 2 o'clock, so I didn't have much time. So anyway, I went to the house, knocked on the door just in case anyone was in. No one was in. Went into the house via the key safe because we had the information on our notes so that we can use the key safe to enter the accommodation. Went in, looked inside the main house, which was quite a nice house, well done up. Shouted out, "Hello, anybody in?" No one, no answer. Looked around the whole house, checked all the rooms. It's not unusual for a GP to do that in case someone's unwell, lying unconscious on the floor or something we need to check. So I checked all the rooms and there was nobody there. So I came back outside of the main house and noticed they had a fairly decent sized garden, quite a long garden. At the back of the garden there was a shed, it looked like quite nicely done up, maybe an outhouse or an annex. So I wandered up to that to just check if anyone was in there. Lo and behold, the gentleman was there. So I went in, door was unlocked, again, nobody in. Greeted the gentleman, didn't get any response. So I thought, okay, let me do my assessment and see if this gentleman is indeed really struggling and at end of life. Gentleman was sat upright, eating lunch, had a sandwich in his hand. He didn't respond verbally, so he wasn't speaking. He was watching Sky Sports TV, seemed to be aware of his surroundings and seemed to be taking on board what I was saying. I asked him I'd do his blood pressure. He didn't give me his arm, but he didn't protest. There was no agitation or signs of distress at all. So I completed the assessment, listened to his chest, checked his abdomen, listened to the tummy, did the blood pressure, temperature and oxygenation levels. All were very completely normal. There was no sign of any person deteriorating there. I thought it was quite well. So I locked up the place, noted that there was CCTV in the outhouse in the corner of the room, and there was also CCTV in the garden. So of course, aware that the family will be checking. So I phoned daughter on my way out, going back to the practice to explain the findings and give her the good news that I think Dad was doing okay. To my horror, I received a very irate daughter saying, "Why did you come into the house? What were you doing going into the house without calling me? I'm working in the school around the corner. I'm coming now. I can come now and see you." I said, "I'm sorry, but I don't have time to go back to the property now. I've got an afternoon session coming up. So I'm pressed for time. I can't go back in and discuss the case with you. I can speak to you on the phone if you want." "I wanted you to call me before you came. I can't believe you could go to the house. How dare you go to the house?" So I kindly invited her to reduce her tone. I said, "Do not shout down the phone to me. If you want to speak to me, you speak in a normal voice, in a normal manner." She then became distressed, stating that, "My dad is end of life." I said, "Well, actually, I did assess him. I didn't think he was anywhere near end of life at the moment. He's quite stable." "What do you mean he's stable? He's unwell." She became very tearful, and I invited her again to reduce her tone of voice and stop shouting. As I'm not shouting at her, I was being quite calm. Eventually, she hung up the phone. So I thought, okay, fair enough. She's not very happy. And I was quite annoyed myself, really, because, it's quite a unique service nowadays, home visits, and it takes a lot of GP time. That's 45 minutes, 50 minutes spent on one patient. That's a lot of GP time. I could see 3 or 4 patients in the practice that time. So most people really appreciate a home visit. This lady didn't. Anyway, get back to the practice, and apparently she's in the surgery demanding to speak to a GP, have another home visit. The receptionist tried to diffuse the situation, and then about 2 hours later, whilst I was seeing patients in my clinic, one of our receptionists, she's only 18 years of age, Ashley, she came to my room saying she's very distressed. The husband of the wife, whose dad I went to see, is in the reception demanding to see a GP, demanding a GP comes and sees him. So I said, I'm not having that. There's no call for them to be aggressive to our staff. Went out there, and the gentleman was very angry and irate. How could you go into the house? This is trespassing. This is against the law. You're not supposed to go into the house without calling us. Why didn't you call the house? Why were you rude to my wife? Why were you this? I said, excuse me, sir. One, do not come in here barging, demanding to be seen, because that just won't work. You need to book an appointment as everybody else has done. And two, I do not tolerate you being aggressive and abusive to staff members here. They don't deserve that. They haven't done anything to you. We do not need this aggression. So of course that put more fuel to the fire. And he was again shouting, you were rude to my wife. You didn't call us. Why have you not followed instructions? Really talking down to me and being quite derogatory. So I said, do you know what, sir? Sorry, I'm going to cut this here. If you want to speak to me, you book an appointment, you get time slot just like everybody else. And there are lots of people here waiting to be seen today, so I need to attend to my patients. You couldn't mind, could you kindly step out of the door so I can continue? He put his foot on the door, refused to allow me to close the door, because of course we've got closed door policy now with coronavirus. We can't just leave the door open. We've got to decide who can come in and make sure the ones that do come in are free of infection and safe to come in and sit in the waiting area. So he put his foot on the door, stopped me from closing the door and said, no, I'm not leaving until I speak to somebody and get this whole situation sorted out. I'm getting someone to speak to me today. I said, it doesn't happen like that, sir. I can call the police to get you removed if you want. So eventually he refused to move and said, call the police. So we had to go down the route of calling the police. I went back into reception, called them, and they said that some police officers will be on their way. But then eventually one of our more senior receptionists, Marie, lovely lady, Irish lady, and very, very stern with patients and doesn't take any nonsense, went out there and managed to diffuse the situation, and then the gentleman left and they were booked in with another GP phone call. But yes, a little bit annoyed by all of that. It was a bit irate actually, and of course it just shows that there's a lot of anxiety and angst around the pandemic, and as well the government and the media telling GPs are not doing this, GPs are not seeing face to face, GPs are being forced to do this. It's kind of making patients get a bit more angry at us, and there's a lack of respect for doctors now. We've kind of been thrown to the wolves by the media and also by the government, who are trying to deflect their own shortcomings onto the GPs by saying, yeah, oh, life would be good if your GP can see you face to face. They're not thinking about why not fund the GPs properly, why not produce more doctors, why not make the working conditions better for people in the NHS. It doesn't happen. So yeah, that's my rant for today. I've gone on for about 8 minutes, but yeah, it was a bit of a challenging day, but it's all fun, part and parcel of being a GP in the city surgery. Have a good day, bye bye.